We don't hear a lot about cervical cancer because there are some ways to prevent it. Getting a yearly pap smear at your OBGYN's office is one of them. But that test just wasn't enough for a Virginia woman. She is one of the 16,000 who will be diagnosed with the disease this year. Karen McNew tells us now about a relatively new surgery that protects a woman's chance of getting pregnant.
Karen Hall is holding her niece Nora in this photo and hoped to be holding her own baby by now. But a miscarriage led to even more serious news in March. She learned that at the age of 29, she had cervical cancer.
In the past, there was no hope for them to have children at all or bear children.
My husband and I had just started trying to have children, and to realize that it might never happen was one of the hardest things I'd ever been through in my life. Second only to the fact that I had cancer.
Carilion Clinic gynecologic oncologist Dr. Dennis Scribner talked to Karen about a procedure that would keep her uterus intact and allow her and her husband Garrett a 50% chance of conceiving a child.
And have about a 70% chance of actually completing the pregnancy and having a healthy baby.
When it comes to treatment for cervical cancer, Dr. Scribner says women will often choose radical surgery over coming into the doctor's office for chemotherapy or radiation treatments because there are fewer long-term side effects. He says with the specific procedure used for Karen, it's most often for women who are younger or want to have more children.
I hope to be pregnant soon. If not, if a couple years down the road it doesn't work, we'll try adoption. We'll try something.
For now, she says she's just taking it one day at a time and enjoying life for what it is.
And that was Karen McNew reporting. Roughly 500 women have had this surgery in the U.S. So far, about 70% of those women have been able to get pregnant. The procedure is covered by health insurance.